This is Julima Wellness Consultancy in Mulela in Theta in Juja in Kiambu in Kenya. Kenya is in East Africa. And I just want to talk more about schizophrenia because of the many cases which is happening here in our country about someone taking life, someone committing suicide because of schizophrenia, and which, if can have been observed earlier, could have been prevented. Thank you. Let me go ahead. Today I want to talk about schizophrenia, the 5 subtypes. The types of schizophrenia are not based on any understanding of the mechanism of the disorder. They simply organize sets of symptoms and tend to appear together. In our earlier historical discussion, we discussed Kriplin's initial concept of schizophrenia, including his formulations regarding some differences noted between various categories of schizophrenia, which he later identified as subtypes. Subsequent classification model identifies specific divisions between these subtypes of schizophrenia. Although symptoms can cut across several subtypes, only one subtype can be assessed by any time. The 5 subtypes are catatonic type, paranoid type, disorganized type, undifferentiated type, and residual type. In practice, people do not fit precisely into specific subcategories because they generally do not remain true to just one subtype. Classification, what is known though, is that people display a defined pattern of features. Schizophrenic features are also divided into 2 specific types: positive and negative symptoms. The competency-based assessment involves a careful evaluation of the clients and what others in their social world have observed. The assessment carefully explores thoughts, speech, perceptions, affect, psychomotor activity, and interpersonal functionings. Other noteworthy areas to explore include absence of insight. The person is non-compliant taking their medications because they do not believe they have a problem. Disturbance of sleep. The person may experience trouble sleeping, especially when the onset of auditory hallucinations and delusions keep him or her awake. Dysphoria. The individual exhibits anxiety, hypersensitivity, anger, and depressions. For most of the time, the disorder has substantially impaired the individual's ability to socialize, work, or maintain some level of self-care. When the disorder develops during late childhood or adolescence, the person tends to fall short of realizing and achieving normative expected scholastic, social, or occupational status. Mood disorders associated with psychotic features and schizoaffective disorder have been ruled out because no major depressive, manic, or mixed episodes have occurred during active phase symptoms. The disturbance is not due to the effect or use of substance, drug of abuse, prescription medications. The disturbance is not directly caused by general medical conditions such as cerebrovascular disease, herpes encephalitis, wank encephalopathy, vitamins deficiency of thiamine, which metabolizes poorly in heavy drinkers, resulting in confusion, loss of muscle coordinations, and unintelligible speech, or Korsakoff psychosis, amnesia disorder caused by damage to the thalamus from chronic heavy alcohol use. If the individuals had had a past history of autistic disorder or another type of pervasive development disorder, then schizophrenia is considered only if prominent and pronounced hallucinations or delusions are also present and last for a month or more, less if the individual has been treated successfully. Thank you. Thank you. Please like, comment, and I will work with you again tomorrow, because I have to go ahead enlightening people about the schizophrenic to see whether we can minimize those kinds of actions of a person killing individuals, killing their own spouses, killing their own children. Since this sometimes, if it can be observed earlier, it can't cause harm like that one. Thank you. Thank you.